Welcome to this webinar on the theme, will you use DHIS2 for beneficiary monitoring after the webinar? Let's see. I am Mireille Chagong, Capacity Certainty Lead at Blue Square, and I'll be your focal point if you need any follow-up after the session. Actually, the idea of such a session came from an observation. Although digitizing programs lead to an improvement of data quality, data availability, and data timeliness, the project managers and M&E managers are still facing burning questions since there are several digital tools. So the question is actually what is the right digital tools to monitor and evaluate my program and also leverage data. So the aim of this webinar series is to help project managers, M&E managers, and mill managers of organization to answer this question. And the program, the webinar, is brought to you by Blue Square and IT for Life. Blue Square is a company specialized in information systems and data analytics for various sectors such as health financing, monitoring and evaluation, geospatial management system, and also logistic management systems. And IT for Life is a social enterprise which provides specialized tools for NGOs and the actors of the social economy in order to help them to make informed decisions to reduce overhead costs. Actually, today is the third session. We started a couple of months ago with a session on monitoring your program with DHIS2, followed by another one on the data collection to visualization, the ComCare use case. We hold this particular session in French and in English. You could find all the last one session on Blue Square YouTube channel, tape Blue Square Hub. Yes, we can, Alfred, we can share you the presentation. And please note that this session will also be in French in 2 weeks, October the 14th. And today your hosts are Romain Lokanovic, who will be the speaker. Romain is the CEO at Blue Square, and the facilitator will be Guillaume Deflo, CEO at IT for Life. Both of them have several years of experience in digitizing organizations and leverage data. So I'm sure they will provide you many guidance and tools and tips. And I give you the micro to give you Guillaume the micro and followed by Romain. Thank you, and please enjoy the session.
Thanks, Mireille. So today's session, we will be talking about DHIS2 for monitoring, beneficiary monitoring. Last session that we did was on ComCare, and the idea here is to give you an overview of how DHIS2 can support beneficiary management and help you decide what's the best digital tool for your program. Today, content of this session will be regarding. We'll present to you some, let's say, standard DHIS2 use cases, how to use the tracker, and the different concepts and features that it has. We'll obviously have a demo for you, and we will also try to benchmark a little bit DHIS2 versus ComCare and tell you when to use which, so when you get to the next time you have to make a decision, you can look back on these little like cues for you to help you make that decision. So I don't know if you've noticed, but there is a Q&A feature here in Zoom that you can use. This Q&A feature allows you to ask questions. I will be looking at the Q&A and answering the questions as they come. So please feel free to ask your questions. And if some questions remain unanswered by the time we get to the end of the presentation, Romain and I will go through them, and we will try to answer them as the best way possible. So please go ahead and do not hesitate to ask your questions. I think with this, I will give the floor to Romain to start the presentation.
Hello, can you hear me?
Yep, we're good.
Yeah, so I was just saying that there is some complaint in the chat that your voice is not loud enough, Guillaume. So if you want to bring yourself a...
Is that better?
That's much better. Thank you, Guillaume. So Guillaume was saying that we have a Q&A session in Zoom, and he will be answering in live the question that you have on the presentation. So I will be presenting the rest of the session, and we'll have a discussion with Guillaume at the end regarding the benchmark DHIS2 versus ComCare for your program. So this is the most important part of the session, I would say. So feel free to ask all the questions that you have during the session, and to discuss with us at the end of the session about this benchmark. Okay, so let's start with the presentation, and I wanted to focus first on a few use cases that we are currently running in DHIS2 Tracker. So for everybody to be clear on the topic today, we are talking about the tracker part of DHIS2 and not the aggregate part that is used by many countries, especially in health, to collect data on routine, on facilities or on districts. So today we'll focus on the DHIS2 Tracker part, and these are a few use cases that, for instance, we are running right now in various countries. So one of the cases that we have is patient monitoring, so clinical pathway. And for instance, we have right now a project where we are following up patients that have cancer in Burkina and Côte d'Ivoire. And the various steps that can occur in this pathway are a routine consultation, where you have a sample collection, especially for tests. So for instance, here it's a HPV test. And the sample is sent to a laboratory that does all the testing and that enter the data back in the system. And the data can be viewed by the medical staff at the health center. So you have this workflow of information that are collected at different places, and this is typically the kind of situation that you can have with the clinical pathways. So this is a summary of the pathway. I'm sorry, it's in French, but it's just to show you that you can support very complex pathway with this DHIS2 Tracker app. And here in green, in red, and in blue, you see the different forms that are filled up by different person over the course of the clinical pathway of the patient. So a second use case is to show you also that it's not restricted to health. So we have also projects that are using DHIS2 Tracker to monitor and to follow up children for a child protection program in South African Republic. So you have typically the steps are identification of children and then orientation of these children and follow up especially for monitoring purposes. You can also have we have a case, for instance, in Benin that is using also DHIS2 Tracker, but for a call center. So the steps are the calls are coming through a toll-free number on the call center in Cotonou, and the people in the call center are registering information and sending the data in the DHIS2 Tracker, and then the data, so the complaints or the satisfaction that is collected in the call center can be followed by action in the field, because the information that is collected, for instance, on a specific facility or on a specific district in the call center can be then redirected to people in this specific district or in this specific facility so that they can take action. And finally, I wanted to share this use case also to show you that it's possible to track other things than people. So for instance, in Guinea, we are working on a waste management project where we are actually not tracking people, but garbage packages. So it's totally also possible to use the DHIS2 Tracker to track other things than persons. Okay, so remember last time we discussed all the theory and words that we use for tracking things over time in ComCare, so in the ComCare platform. And you have the same in DHIS2. So you have a lot of terminology, specific terminology that is used, and that I will clarify in the two coming slides so that the demo is clear for everybody. So tracking things over time, what does it mean? As I said, we can track different things: household, people, facilities, waste packages. Anything that you want to track over time can be put in a DHIS2 tracker. So this thing that we want to track in time is called in DHIS2 a tracked instance, entity instance, so TEI. It's a quite complex word for something that we will keep that will stay the same over time, and that will track with different data collection forms. So we can collect various forms on this TI over time, and the data that you are collecting will be persistent on your mobile device or on the web platform. So you will be able to access the file of this TEI anytime if you have access to this file on your mobile or on the web platform. So a bit of terminology, and it's only one slide, I promise. So tracked entity instance, I've talked about that. It's the thing that you want to track. And then you have tracked entity attributes. So this is all the information that you want to know about a TI that won't change over time. So for instance, the name or first name of a person won't change over time, or date of birth. And you want that to be some kind of encoded with the tracked entity instance, so that you can identify this tracked entity instance, find this tracked entity instance in the platform. For instance, looking for a patient with a name or with a unique ID, for instance, that's also an attribute of the TEI. And then we have in DHIS2 two types of programs. So one type is event program. It's quite simple one-shot data collection that you can repeat over time, but there is no tracked entity instance. So I will just show you that in the next slide. And then you have the tracker program, and we'll focus on this today, where you have several data collection happening on the same TI over time, and you can define a lot of logic on these data collections. Just three last words. So enrollment is the first step of a tracker program, where you actually collect all the tracked entity attributes. So everything, the name, the first name, the unique ID, will be collected during the enrollment. And then you have stages in a tracker program, and this corresponds to all the data collection stages and forms that you will collect on the tracked entity attribute instance. One last word is referral. So it's something that can happen, for instance, if you have a tracked entity instance that you move from one facility to another, or from a district to another district. And in DHIS2, we call that organization unit. So it's OU. So this can be a facility or a district. I will show you that in the demo. Okay, so this is how it looks like, and I showed you the difference between event program and tracker program, and I will focus on the tracker program. So, on the event program, you have basically an organization unit that can be a facility or a district, and you collect forms repeatable in time, but that's always the same form, and you don't have anything that you can track in this facility. In the tracker program, you have the same thing. So you have your organization unit, and you'll see it's a very important concept in DHIS2, and you will be able to identify and to enroll different TEI in this facility. So that can be a facility or a district, sorry. And you have this enrollment stage, where you collect all the attributes that you want to collect on your TEI. And then you can have different stages, and you can, depending on the answer that you give, for instance, on stage 1, you will be able to be directed to stage 2A or stage 2B. And also what I wanted to insist on is that very different people can fill up the various part of the tracker program. So for instance, you can have a secretary that is doing the enrollment, and then a nurse or a doctor that is filling up the stage 1, sending all the data to a laboratory that is 100 kilometers away, and who will access the data of the patient and will be able to enter the results of the lab test, for instance, etc. So just insisting on the fact that you can, with user access management, you can actually give access to very defined stages of the tracker program to different people in the platform. Okay, so I will go right away to the demo, and the goal is really to show you a few key features that exist in the DHIS2 Tracker, and to show you then very quickly how to configure that, to give you a sense of how difficult or easy it is to add or remove questions, for instance, in a questionnaire. So before moving to the demo, I just wanted to do a reminder for everybody, and we discussed that during the first session. So what is the steps that I actually did already to be able to do this demo? So what you need to do to set up your DHIS2 platform is to install your platform on cloud or on your servers. To configure your organization unit. So this is what we call the pyramid in DHIS2, and we'll see why it's important. And then to configure your users, so creating your users with specific access rights. And finally, to configure your program. So we did configure for today a very simple program, but you can, of course, configure a very much more complex program than the one that I will be showing. And this can take a bit of time to do all this configuration. But once you're ready, you can test your tracker program on web or on mobile. So I will show first how we can navigate and do data entry in the application, then how it's possible to modify things in the application directly in the platform, and then I will show a bit about indicator and visualization. So can you still see my screen?
Yep, you're good.
So I will show you very quickly the data entry on the web platform, and then the exact same thing on mobile very quickly. So the first thing that I wanted to show is the organization unit pyramid. So here you have the disaggregation that you want to have, and most of the time this will be geographical disaggregation. So you select a region, a district, and then you are able to enter the data on the specific district you are in. So for instance, let's take the case of a beneficiary management program where you have you want to have a disaggregation over regions. So you will select the regions that you are active currently and select the program that you want to enter data on. So this is the beneficiary management program that I will demo today. As you can see, we can already see in the web platform, but it's also the case in mobile. You can see all the register, all the tracked entity instances that have been registered already. So you have 4 in my region. You already have 4 people who have been registered in the program. And you are able to see them in a list. You can, of course, edit the attributes that you want to see. So these are all the attributes of the tracked entity instance that you can see. But you can also search. For instance, you can say, okay, do you have Jane in my platform? And what you can see is that I can look at what is in my region, but also in other regions. So this is totally configurable through user access, right? You can prevent that if you don't want people from one region to see other tracked entity attributes in other regions. So you will see all your tracked entity instance here that have been registered in the past. So let's register a new person in the program. So what you can see is that you have this section that appears when you click on register, and you are able to collect a geolocation point. So here on the web, it doesn't make a lot of sense. So I will set the coordinate here and I capture, but on mobile, you can select the place where you are. And then you have the enrollment date that you can change. So I will put the date of today, but that's totally feasible to change the date, and you can change the enrollment date. And then you can enter data. So I will put some data about John Doe here, and this person is 32 years old. And I save and continue, and then the enrollment stage is done. So I'm opening the file of the person, and I can see every information on this file regarding the enrollment. So I see the profile information that can also edit afterwards, and I see the information about the enrollment, so especially the geolocation point and the date. So the file is created. So I'm at this stage where I can actually start encoding forms on the patient or on the beneficiary. And how to do that? So I click on the plus here, so on the data entry timeline, and I will see the first form that I'm supposed to enter. And here you also the possibility to disaggregate your information by, for instance, organization. So if you say, okay, I'm working for organization 1 and I will register this this beneficiary, I select organization 1 and I say, okay, I do this report today also, same date as the enrollment. But it's totally possible that the enrollment happened yesterday and I'm only filling up this form the day after. Okay, and then you can have a very simple data entry form. And I wanted to show you a few features that are available. So first feature that is available is everything that relates to computation. So for instance, here you see that the form will generate a score that will be based on the answer that I put here. So for instance, if I'm a single, so the beneficiary is a single male and needs assistance for food. So I see my score that is evolving and doesn't need a shelter, I have a score of 1. The second feature that I wanted to show you is also that you can hide and show question based on answers. So it's quite basic here, but if you say yes, is a need for shelter, then you have to specify the number of beds that you need. And you see that my score has evolved because I also need a shelter. You can see this also stars, red stars that are indicating the questions that are mandatory. So if I don't fill up this question, I won't be able to click on complete. So then I click on complete and I say, okay, my first form is complete. So my stage 1 is complete and I have all the information there that is available. And what is important there is that if someone else elsewhere in the world connects and has access to this region and to the beneficiary that are registered in this region, this person will be able, so your colleague will be able to see the same file and will be able to consult all the information that you have registered already on Form 1. So a third feature that I wanted to show also is the fact that you can make stages or forms conditional. So for instance, here I click on plus and I don't have any other forms to fill up. So the data collection is finalized. But if I incomplete the data there and I select then single male with children, then I have the score that evolves also here. So the score depends also on the question here, and I complete. Oh yeah, sorry, I just didn't mention that, but you have a warning that appears that say, okay, don't forget to fill up the Form 2 children. Okay, and what appears then is that if you click on plus, then you have access to Form 2 children, which was not accessible beforehand because I had selected male without children. And then you can also select the organization. So I'm still organization 1, but that could be someone from organization 2 that fill up the form. And I have to say, okay, I have children of that age, children of that age, and a third children of that age. And I complete. And then my data entry is over. I can go back in the region and see in the list the file that I just registered, so John Doe with 32, and I can click on that file, come back, see all the data entry that has occurred there, see all the information on children, etc. So again, this is something, you know, if I disconnect and someone else elsewhere in the world connects, it will be able to see the same list of patients and will be able to take action on this patient. So this is how it happens in the web. I will just show you in a few minutes how it happens on the mobile. So I'll just up. Do you see my you can go back. Do you see my mobile here? My tablet that is
yes.
Okay, perfect. So I will just show you how it looks. So again, I'm connecting to the DHIS2 application that you can download on the Play Store directly. And then, wait, just wait that it's connecting. Okay. Okay, so I will have exactly the same features on mobile. So if I select my program, beneficiary management, I will see all the patients that are registered on my tablet, but I can also synchronize with the patient that have been registered on other tablets, but for the same region, for instance. And I will see these different beneficiary that have been enrolled. So I can access the information about this this patient by clicking on them, or I can register a new one. So I'll just show you how to register a new one. So I need, for instance, to see. Oh, sorry, this is the emulator that does that. So we'll just see if I have someone that is called Pierre, Peter. Okay, sorry, Peter, and look for that. I have no one that is corresponding to this person, so I will register a new person. So I have the same form that is available on mobile, and I will enroll this person. So here I'm on an emulator, so I won't be able to have the GPS also, but if on the real tablet, you will have the GPS that is on your location. And then you have the same attribute that you need to fill up. So first name, Peter, name of Peter. And then I have the age that I have to enter, so it's 45. Okay. And I can save the enrollments. And I will be able to start the data entry for, so I'm saying I'm organization 1, and start the data entry on mobile on the type of beneficiary. So I'm still a single male. Then up, just so that I can see the children also. So I'm single male with children. And then section 2, I need a food assistant. Then I need a shelter. I have also the question that appears. I need 2 beds. Sorry, 2 beds, and then I have the score that is generated, and I can save this. And I do finish. Sorry, and complete. And then I've created my file, so I can see Peter, name of Peter, and I've already filled up the beneficiary details, and I can go on to fill up the children form. So this is the exact same environment that you have on mobile and on web, and the configuration is common to the two. So if I do changes in the configuration for the web, I will see that also in mobile. So that was for the first part, for the data entry, and now I will show you how to modify this form directly in DHIS2. So just to give you, I will do a simple modification, but just to give you a sense of how it can be easy to change things in the DHIS2 tracker. So I will duplicate my screen, and we'll go. So in DHIS2, when you want to do modification on the forms, you go in the maintenance, and I will go in the program. And then I have different sections where I will be able to modify the program. So if I go in the program session, I will find the beneficiary management program that I was using to enter the data. And I will be able to add information in this program. So you have a different section to do the setup of your program, and the first one is really about program details, and then you have the setup of the enrollment. So I will show that, and then you have program stages, so the different forms that you want to collect on your beneficiary. No, sorry. So the enrollment data will be there, but what I'm interested here is to collect additional information attributes during the enrollment stage. So during the enrollment, I want also to collect the birth date, for instance. So that's redundant with DH, but it's just for the demonstration. And I will go there and say, okay, I want them to be displayed in the list, not mandatory, but searchable. So this is everything that happens in the search bar here. So you can you can select whether you want them to appear in the list or not. This attribute. So I added this birth date, and what I will do also is to go in the first form, and I will add another variable. So for instance, I go to data elements in DHIS2. Data elements are the name for variable, and I will add something related to, I don't know, age in years, for instance. No, I already asked that during I would put to have a problem with my liver, you know, or I put clinical status. I don't know what it is, but just to show you that I can add variables like this, and I can say, okay, this is a variable that is compulsory, so I won't put it compulsory there, but that I will add it in the form. So as you can see, the configuration of forms is can be done by section, for instance, here, and to add a variable in the clinical status variable that I just added to the program, you just have to select your section and then add this variable, and you can select the order that you want to see there. So it's a very simple configuration of the data entry form there. You can have more advanced configuration using custom forms, but for the section form that I just showed, it's quite simple. So I'm updating this form and I'm saving the 2 changes that I've done. And in DHIS2, when you are doing modification on forms, you have to clear the cache of your browser. So it's quite simple. It takes a few seconds, but if you don't do that, you won't be able to see the modification that you just did. So if I'm back in the web application, so DHIS2 is reloading everything, so the pyramid and the program, so that can take a few seconds, but I will be able to see all the modification that I've done in my program. So for the enrollment stage, and then for the first form of the program. And again, this modification will be also available on mobile. The only thing that you have to do on mobile is to go in your settings in your application, and I will go back to the landing page. You just have to go to settings and then to refresh the forms by using here in setting the sync configuration here. So this happens every week automatically, but I can manually force the resync. Okay, so this takes quite some time because the pyramid is quite big in this play instance of DHIS2. I'm just also taking this time to invite you to test all these features by yourself in the play.dhis2.org. So it's DHIS2 instance that you can access with the user credentials that are on the landing page, so you can test directly by yourself right now without installing anything. You can test the feature that I just presented in this DHIS2 platform. Use the 34th version, and you will be able to see the program that we have set up today. So it's the beneficiary management. Okay, so in the meantime, I will switch to the third part of the demo, and which is how can I see all this information that has been encoded in dashboards and in graphs. So as you can see here, I've different regions, and actually before the demo we have encoded information in the Bo, Bombali and Bonte regions, and let's see how it looks when I'm on the dashboard pages. So the advantage of DHIS2 is that you can have already in the platform, so everything is integrated directly in the platform. You can have tables or graphs that you can use to look at the data that you have encoded. So I've just configured two very simple dashboards. The first one is a table dashboard. So it's something that we configure for most of our projects, is a place where you can actually extract all the raw data through tables. So here you have a table that is summarizing over the last 12 months the number of beneficiaries that have been registered with the score that they got. And as you can see, we can see the beneficiaries that have been encoded in Bo, in Bonte, and in Bombali. And you have different scores, you have the total, etc. And you can actually, so this is really a strength of DHIS2, that this information will be updated in almost real time. So you will be able to see your information. When you open your platform, you will be able to see updated information about your beneficiaries. And then to download this table, you just have to open it in the event reports, and then download it in Excel, for instance, or any. So yeah, I would. Okay, so it's not possible on Play, but on any production platform it will be possible. So yeah, you just go there and you download with Microsoft Excel. So this is the summary table. So it's summary for scores, but you can also have the listing here. So I put a detailed information, and you can see in all the provinces the cases that we just encoded this morning. So you can see the 4 that we encoded this morning. I cannot see yet the one that I encoded during the demo right now, but you can see all the other one. And then you can also do graphs. So I did very simple graphs, and also showing you the kind of disaggregation that you can have. So this is the number of beneficiaries that have been enrolled by organization 1 or 2, and you can see also how it splits over the different regions. So you can see the number of beneficiaries or the number of. So this is the total score actually, and we should have the average score. That should be better, but you can see the average score per region on a map. And you can also look at the children age repartition or the splitting and any other this is the total amount of children enrolled all the time. So you have all this information that is updated almost in real time in DHIS2 without connecting any additional data visualization tool. Okay, so this is it for the demo, because I wanted to. Sorry, I'm just checking if yeah. So it's back there. I'm just showing you the modification that we did on the form. So as you can see here, the birth date is now here, so I can collect the birth date in the enrollment. So this is the modification that we have done. I will just continue to the form to show you that. Okay, I'm selecting organization 1 to show you that the additional variable that we have put here, clinical status here, is available now in the first form of the data collection. So all this small modification can be done quite easily in the configuration of the program in DHIS2 directly. Okay, so coming back to the presentation to save us at least 10 minutes to discuss the benchmark, because I think it's a question that most of you can have if you are running programs and you are questioning if you have this kind of question, what is the best tool for my program? And for instance, how can I choose between ComCare and DHIS2? And it's not that an easy question to answer, so we try to summarize this as much as possible in these slides. And I think this slide you can use for internal discussions also if you are facing this kind of question in your organization. So I did 3 slides that are comparing these two platforms, and the first one is related to system and hosting, and I will describe a bit more about that. Then we have data collection, especially on mobile, and data management. So all the data collection phase and how I can see my beneficiary and manage them in the platform. And then we have the data analysis, visualization and feedback slide. So to summarize, and I won't go into details, most of the information the most important information is in bold. So a big difference between DHIS2 and ComCare is that the server will be much more easy to install if you are using DHIS2. ComCare is a bit more tricky, so you need to either to work with DMAGI or with IT4Life. I think there are not a lot of other providers that are offering the hosting of the installation of the server. So it's just a thing that you need to take into account. The two are open source, no difference. You can have providers that give you access to already hosted platform for DHIS2 or for ComCare. So again, DMAG and IT4Life can provide you that. Multiple language API. So not a lot of differences there. Maybe DHIS2 will be a bit more advanced in terms of user access management. So especially if you want to restrict. So if you have sensitive information about patients or things that you want to give access very in details, to control user access in details, then DHIS2 may be a bit better. And then on the scaling part, so there are much more very wide programs that are using ComCare than DHIS2 Tracker. So this DHIS2 Tracker is a bit still a bit young, and ComCare is a bit more mature. So you have very big programs that are using ComCare, and they might have less issues when scaling with a high number of people collecting information at the same time. So this is regarding the system and hosting. Regarding the data collection and management, so on the web data entry, DHIS2 is maybe a bit better than ComCare, but it's mostly on the not on the data entry, but on the management of the beneficiaries. For instance, the listing that I showed is something that is maybe a bit better in DHIS2, but not a big difference. But for the rest, especially for all the mobile features, ComCare will probably be a bit better than DHIS2. So regarding issue that you can have with mobile synchronization, data synchronization, the fact that you can work on any device, especially devices that are a bit cheaper, ComCare will probably work better on cheaper devices than DHIS2 Tracker. The configuration is quite easy in ComCare with the form builder. I showed you that in DHIS2, but that can be a bit complex when you are trying to build more complex form. Then you have an online preview that is available in ComCare platform, so you can see directly on your web interface what it will look like on mobile, which is not available in DHIS2. You can see that on the web data entry only. And then you have on the logic sides and on the mobile user experience, and also on the relationship side, I haven't talked about that, but having, for instance, beneficiary that are related to a household, where you can collect information about the household, but also about individual beneficiary, that might be a bit better on ComCare. So in summary, the mobile application, and this is the core, the core positioning of ComCare is providing you the best mobile application that you need for tracking beneficiaries. And the DHIS2 Tracker is maybe a bit less good on mobile, especially. And then we come at data analysis, visualization, feedback, and this is where DHIS2 is definitely having a plus compared to ComCare, because you have all this aggregation that is really at the core of DHIS2. So especially is the geographical aggregation that is available. So you can register data on a specific facility, and all this data will be aggregated. For instance, if you want to check, your data at region level, you will be able to compare all your regions, even though the data is coming from facility, because you have all this organization that is available, all this pyramid organization that is available in DHIS2. And the dashboarding and indicators are a core feature also of the DHIS2, generally speaking. So if you want to have visualization on top of ComCare, so you have basic reports in the ComCare platform, but if you want more graphs or better visualization, then you will need to integrate that with the BI tools such as Power BI or Tableau. So that might be a bit more work there, while in DHIS2 Tracker, we will be able to see that directly in the platform very easily and configure your dashboard very easily. So this is the comparison. So to summarize, and I try to be as impartial as possible. So if you are looking for really focusing on something that is robust on mobile with all the possibility that you want in terms of logic, in terms of user experience, then you should definitely go more with ComCare. So your technology of choice will be more ComCare. If you are looking for something that is really integrated, so you don't have to worry about plugging BI tools on top of your platform, etc. So you want the data collection, management, and visualization to happen in the same platform. And you want also something that can be easily installed on servers, especially if you're working with partners who want to have servers that are installed locally, so in the countries, or if you want to install that directly in your organization with your IT team, then you might definitely go with DHIS2 Tracker. So we will have less advanced features on mobile in terms of logic or in terms of user experience, a bit less good than the Comcare platform, but you will have all this integrated platform in the same place. So that's it for the presentation. I see that there are a lot of questions in the chat, so maybe you can take some of them now.
Absolutely. So the first question was regarding, would we have a French version of this? So I think this has been answered. 14th of October, the same session in French. So that's good. Then we have questions regarding, can we use the tracker as we see it in this demo in an online setting?
Yeah, so you can definitely use the tracker by connected to the Play DHIS2. So if you type play.dhis2.org, you will come to this page, and you should select the 34th, and it will redirect you to this platform where actually you can see the dashboards, and you can also do the data entry directly by yourself in the tracker capture app.
And the offline data collection offline works on mobile and on the web, or only on the mobile side?
So it works only on mobile. They try to do some offline mode on the web, but it's not very robust, so I would not recommend to use it.
And is everything available on the web also available on the mobile feature-wise for data collection?
Yeah, so everything is available on mobile when it's on the web. The only thing that I would be careful with is the custom. So when I discussed the configuration, using custom data entry form won't work well on the mobile. So if you are using in your program stage here, you use the custom here, so you can generate a data entry form with a table, for instance. Here it will work well on the web application, but on mobile it can be tricky.
Cool. Thanks, Romain. I'm just typing the answers at the same time. Okay, because we have a bunch of questions from Maurizio. So I think, okay, so I think regarding the offline, we already answered this, so that's fine. Is data encrypted at rest? And if yes, how?
So the question is data encrypted
at rest? So is it encrypted when it's stored, when you're not using it?
So you can select the encryption of the data, yes, in DHIS2.
And that's both true for server and mobile?
Yes.
Okay.
So this is something that you can configure in your program. I can't remember exactly where, but you can define the fact that you want encrypted data there.
Great. Regarding APIs, how does it work regarding authentication in particular?
Regarding identification?
Oh yeah, authentication. So if I want to make an API request,
so you need a user. You need the same user as with the user interface, and then you can connect with using this user through the API.
Well, there's an extensive API for DHIS2. It's very powerful. You can perform data entry via the API if you wish.
Yeah.
I'm going to share the documentation so you can see how actually all this works in detail. But there's a bunch of authentication methods, including 2FA that will be supported, and OAuth2 as well. So you can check the details here for all the API questions.
Sure. So I mean, this is really a strong aspect of DHIS2. So is the well-documented API. So I've added that in the slide in the system on the API. So there's also one in Comcare. It's a bit less documented than in DHIS2. But you can actually, you can use it. You can use this API, for instance, to upload all your legacy data directly through the API.
And we have one more question from Thomas regarding how much time does it take for data entered on the tracker to be available in the reports?
Okay, so this depends on your configuration of the server. So you can basically it depends on what is called analytics in DHIS2. So if you want your analytics tables, so the tables where all the dashboards are plugged in. So actually, yeah, if I go there, this table, so all this data are coming from the analytics table and not from the database that is receiving all the data entry. So if you want to see the data that is available that you just entered in the platform, you need to refresh this analytics table, and this is a parameter that you can define in DHIS2. So if you want to refresh your analytics every 1 hour or 2 hours, that's totally feasible. It depends on the volume of your data, because it can take, if you have a lot of data, it can take 30 minutes, 1 hour. So yeah, that might take some time. But if you have only hundreds or thousands of submissions, then it will take a few minutes. So you can run that every 2 hours, for instance.
Okay. Scroll this down. We have one more question regarding, do we have a comparison between DHIS2 and OpenSRP? Do you have any experience with OpenSRP?
So on my side, on Blue Square side, we have limited experience. We've done, I think 2 years ago, we've done a test of OpenSRP. But yeah, that would be definitely an additional tool to add in the comparison, in the benchmark. So if you have information and if you want to participate in that, adding OpenSRP to the benchmark, I'm definitely interested in complementing this information. I mean, the question about OpenSRP was at some point how it works on mobile, and yeah, this is something that we haven't tested for 1 or 2 years. So if there are updates on that, yeah, I'm very interested in, and I don't know who asked this question, and if this person has any experience on OpenSRP, but I would be interested in getting in touch.
It's an anonymous question, anonymous attendee, so I don't know who asked.
Oh, it was an anonymous one. Okay. All right, but we'll complement that maybe in a upcoming session about OpenSRP. So for those who are not aware, OpenSRP is a EMR system, open source EMR system that has been now released for many years. So yeah, we might complement that in the next session.
Okay, I think that's it for the question. Oh, one more question. Okay, cool. No more questions. Just a comment. Thanks, Maurizio. No problem. Happy to.
Okay, great.
Happy to help. Any last minute questions? We still have 3 minutes, so we're happy to wait for more questions.
I see that
to come in and have. Well, that's on the chat. Wait.
I see that there's a comment about the fact that I'm marketing Comcare. So I don't think it's the case. I really think the goal was to show the difference that you have between the two platforms. And I think, I mean, again, I would be really interested in your comments about the comparison. We've done that with Guillaume, quite in depth, thinking about whether we should put 2+ or 3+ for any feature. But if you have specific comments, or if you think that some of this information about specific features are not do not seem right to you, please feel free to get in touch with us. I mean, I think it's not something that exists, that is available openly as this kind of information. So it's a first attempt, of course, to compare different technologies. And yeah, if you are interested in improving this comparison, this benchmark, either by adding new tools or by commenting on specific features that you think it's unfair the way we presented it, then please get in touch with us.
And I will add that the first question you should ask yourself is really like, what's the best tool for my program, rather than what's the best tool, because each of these tools has specificities. I think Romain was trying to highlight them. and it really depends on what you need, and based on what you need, you should use like the best possible tool. In some cases, DHIS2 will be the best tool. In some other cases, ComCare might be the best tool. Some other cases, maybe OpenSRP might be the best tool. So, or I don't know, like some other things. So I think the idea is really like based on your needs, what is the best tool you need for your program, for your organization. This is the good way to sort of like tackle the question. Okay, I think we're at time. Thanks a lot for your questions. Costs. Okay, I think that's a really good question. Let's take one more minute around costs. So I think Colma, you want to answer it? So can I go ahead?
No, maybe I can start. So regarding the licensing, so these two tools are open source. So you are not expected to pay license costs for that. But actually you have to ask yourself about hosting costs after that. And I mean, this is where I pointed out one of the differences between DHIS2 and ComCare. So DHIS2 is something that you can install on the cloud or on your servers quite easily. You have a good documentation for that, or you can ask a service provider, and you have a lot of them that can provide you with hosting and of your platform. For ComCare, it's a bit different. So DHIS2 is the software editor of ComCare. So they are proposing ComCare as a SaaS, but so which means that you have to pay. It's not license cost, but it's some kind of hosting cost every month. And I think IT for Life, you propose the same. And I think IT for Life is maybe the only provider outside of DHIS2 that is offering ComCare hosting. I'm right, Guillaume?
At least one of the only ones. Sure. So I think to complement this, DHIS2 will give you ComCare as a SaaS, as Romain said, meaning that you will pay for hosting and for a set of features. So the more features you want, the more you pay. This is a typical SaaS approach. Although, as Romain also said, it's open source, so you can host it yourself. It's a bit more difficult. The stack is a bit more complex and less, let's say, less containerized or dockerized than DHIS2 is. So it's a bit more difficult to host. Hence, the added cost here to get the cost of acquisition is a little higher for ComCare. But then developments, I think, those tools have great documentation in terms of what you can do with them and how to be able to do your apps in them. So just a matter of reading the docs and getting someone in your organization to level up, or to use service providers, in which case you won't have any sensible difference, I suppose, between the two. You can look up pricing for ComCare on their website on dimagi.com.
Thank you, everyone. I will leave myself to answer in French to Niogo Fousseni. On aura une session en français le 14 octobre. Donc, pour ton commentaire dans le Q&A, on pourra avoir des points en détail en français. Merci.
Okay.
So I think we are through.
Thanks, everyone.
Thank you, everyone.
Thank you.
Don't hesitate to reach out for a follow-up, and you will be sending the YouTube video for you to watch it again. Thank you, and see you next time.